When LASAM started in around 2015, you understand, we had a lot of issues around availability of these essential drugs across both secondary and tertiary facilities. But the first thing we did was to start the issue of development of scorecard around that will show exactly what was the situation like.
Initially, there were about like 40% stock out, of essential life-saving commodities at the primary healthcare centers, and quite a few even at the secondary level, that's at the general hospitals. And when we actually saw that this was a very huge gap, because this is something which has direct impact on maternal lives.
Essential commodities during pregnancy and during labor. When we came in, it was horrible. When the data was analyzed, it's all red. And that is the job of the scorecard.
After our political economy analysis, we saw that, look, we needed to approach the State Treasury Office, of course, the permanent secretaries and the Ministry of Economic Planning and Budget, of course, our own health sector ministry. All these various key actors, had to be approached to ensure that there would be no bottlenecks, and all those bottlenecks would be removed.
So the first scorecard that was presented to the Commissioner for Health, he couldn't believe it. That what is the essence? That the ministry have been spending so much. Are you not trying to tell me that the money is not making impact on the community? After some time, it was explained to him, this is how this thing works, this is how this thing works. And I think they did their underground findings, and then it came to the reality that, okay, if this is our reality, then something has to be done about it.
We didn't blame anybody. We were just trying to say, how can we strengthen and improve the systems? So it's LASAM teams trying to look at those data and trying to look at which facilities is doing well. What are the problems? Why are they not having it? Is it issue of supply or issue of logistics and co?
Our criticism is constructive. We are like a information broker, between policymakers and the community. We give feedback.
Because of the periodic reviews we had quarterly, so everyone was on their toes, and of course we have a general dissemination where people are called out from the various health centers, those who are in charge of those units, to ensure that they can actually see that what is the reason, what was the problem? Is it that they were not getting, vehicles to bring in the stock in time? Is it that they were not making data available in time for them to replenish the stock? All these gaps were, identified at those review meetings which we had regularly. And as a result of that, gradually we saw that every year there was an improvement up to the point where we now got to zero stock out in 2020 for the first time.
And then government now started working on it gradually, not only in the general hospitals, the secondary facility, as well as at the primary health care center, at the primary health facility. So they started working on it gradually, and you won't believe it. Come last year, we have, in fact, 2019-20, we have zero stockouts of essential commodities in all facilities giving deliveries.
In the last few years, part of our key successes has been that we have zero stockout of life-saving commodities across the primary health centers and across the states in general. And when I say life-saving commodities, I'm talking about tab misoprostol, I'm talking about injection magnesium sulfate, I'm talking about injection oxytocin, I'm talking about tab ORS, pediatric zinc, and low osmolarity ORS that is needed for acute childhood diarrhea in children.
So for us, it's an anathema. It's unacceptable if you practice and you don't have oxytocin. Why shouldn't you? What are the problems? Storage and all of that. What is the alternative? Misoprostol. Misoprostol must be available. So if you are doing your review, you must tell us precisely how much of these you have. Magnesium sulfate I mean, these are cheap but fantastic commodities that have revolutionized and positively impacted on the management of some of these leading clients, especially hypertensive disorders. They are available, so the state makes it mandatory. It's another mandate, it must be there. The state budgets for it, provides, and says where there are gaps in provision, it must be available.
Achievement of zero stockout in Lagos State is highly significant because it has translated to real services, similar services to mother and child at the point of birth and at the point of any other issues around childbirth. Those key essential communities are always available across all our facilities, at both primary and secondary facilities. Lagos State government was able to achieve zero stockout. I will just put them in based on three things. One, we have a very good listening leadership that is ready to use evidence to drive the process. Lagos State is blessed, from the Honorable Commissioner, Foreign Secretary, to all those that are on that. They were actually craving for that data that will guide that decision. So maybe that the soccer started coming out. They saw it and they came to it. The second one is that we have a Director of Pharmaceutical Services that is very vibrant. Why have I said that? In terms of quantification, they do their things by themselves. They know exactly what they need at the various facilities. And the last one, understand, it is the involvement of the coalition.
Lagos is a very, very dynamic state. It's a state that continues to ensure that every facet or every sector works in line with global best practices. And if you are going to do that, you will need to embrace other people's ideas and tease out what you need, what is going to be relevant, and what will help to improve your system. In fact, that's why Mamai, one of those key successes, and because we embraced them, is the reason why Mamai project has been a success in Lagos State. Mamai came up with the LASAMs, the idea of LASAMs, and they were the ones that helped to institutionalize the 3 subcommittees and brought CSOs together. They brought implementing partners together, and of course governments, all the relevant stakeholders that have a key part to play in health, maternal and child health together, so that they could work together to continue to help to reduce maternal and child health in Lagos State. And that's one key thing that Mamai has done for Lagos State.
Can you imagine CSO working successfully with the government? I mean, Lagos State has been able to achieve that. LASAM has been able to achieve that. And I can say the same thing for other slums. E4A came out with very, very laudable projects.
Mamai came up with 3 subcommittees, the evidence-based subcommittee. They also came up with advocacy subcommittee. They came up with the knowledge management subcommittee. These subcommittees could be replicated in other areas, not necessarily for maternal and child health. You could replicate them in other areas for use to help to improve that particular sector, as the case may be.
Data, data, data. Data is life. During the advent of the COVID-19, the government said he would have taken some giant steps, but he didn't have the right data. Data has contributed significantly to the achievement of whatever we have as a government in Lagos State.
One of the important aspects of institutionalization is the fact that the whole collation of data has become prioritized in the state, because they know that every time they have to be called to account.
And we'll continue to monitor. We'll also continue to ensure that proper monitoring occurs at the last mile to ensure that we capture our daughters on time. So these are things that we'll continue to do. We'll continue to ensure that data harmonization continues to go on and is strengthened at the LG and at the state level.
I believe with kind of structure we have on ground now, it can be sustained very, very well. Why am I saying this? Because the state government is taking the ownership of whatever we have started with under LASAM. You understand? They have seen LASAM as a tool that was used to drive the right process.
For the first time, the Ministry of Health are actually put into their funding, in their budget, where LASAM activities, their meetings, review and planning meetings, scorecard development, are all being budgeted for, so that it continues beyond the lifespan of any development partner. It's something they now own, and it's something that it can only get bigger.